morning, everybody, and welcome to the Royal Society for Medicine and to our conference this morning. I'm told that we have a totally full conference today, which is really great news. And I think it shows the importance of the subject at hand, the Health in All Policies agenda, which you're going to hear more about today in great detail and with lots of energy. But can I ask you first, we'll have some latecomers, I'm sure, to kind of budge up in the middle and make sure that we don't have too many empty spaces so that the latecomers can fill in on the end of the rows, so that that'll make it, thanks a lot, that'll make it easier for those people that are arriving. And I want to also save you some effort, so thank you so much. You're so well behaved. I've never been a teacher, but I always thought it'd be really difficult to get people to do things like that. When I go to conferences, I'm an obsessive note taker, and then the next day when I'm thinking what I might tell my team about the subject, I inevitably can't read what I've written, such a scribble. So I want to let you know that everything will be filmed today, and you will have all the presentations. So you may still want to take notes, but be assured that you will not miss anything, which I think is really important. So my name is Shirley Cramer, and I'm the Chief Executive at the Royal Society for Public Health. And I was very pleased to be asked to chair this morning's session on a subject that I'm really passionate about. So this topic could not be more critical in terms of both public policy and at a national, regional, and local level. Today you're in for a really big treat, because not only do we have a wide range of speakers, but they're all noted leaders in their field. The characteristics that our speakers today have in common is that they're all innovators, they're all influencers, and they're all about implementation, getting things done. Our speakers today have added significantly to the national picture and progressed the thinking, the evidence, the policy, and the practice for this agenda. In their presentations and reflections, I have no doubt that we're going to be challenged to think differently by the end of today. So in my remarks at the Royal Society for Public Health, we've been saying, along with many others, that the way we think about health needs to change radically, which is why you will often hear us talk about the public's health and not public health per se. If I went out onto Wimpole Street now and I asked anybody walking by about health in the UK, they will immediately tell me about the NHS. They will immediately conflate health with our National Health Service. This is of course, our illness service, 70 years old this year, and much beloved of every one of us. And I'm sure many of you followed the Twitter storm yesterday following Trump's ridiculous remarks about the NHS. But interestingly, in fact, the King's Fund examined the British Attitude Survey data, and they looked at it over many years and concluded that what the public want consistently here is a health system provided by government where access isn't restricted by income, and that's a top priority for extra spending. And who would want to argue about any of those three? But wouldn't it be better if all the aspects of keeping healthy were provided by government, a top priority for spending, and if we all had equal access. We know that health is determined by many, many aspects of our lives, where we're born, where we go to school, where we live, the kind of job we have or not, or that we don't have. And it's not a coincidence that in more equal societies there are less health inequalities. And to me, it would be really optimal if all the services that we need to keep us healthy, for our health and well-being, were as recognised, as loved, and as equal as the NHS. Loads of stuff has been written about the need for a real focus on prevention. And most of us haven't forgotten the Oneless report, written in 2002, which was a brilliant report, but actually had very little effect. And now we've got 5% of the budget committed to prevention of the whole health budget. Really, really small amount. So we do really need a renewed focus on tackling the social determinants of health. Currently, this is probably best described by the Robert Wood Johnson Foundation in the USA. The largest foundation there, which had been focusing very heavily on improving tertiary healthcare in hospitals, but a few years ago rethought its whole mission, and now is building a culture of health so that everyone has the opportunity to lead longer, healthier lives. And at the core of what they're talking about, what they're funding and what they're doing is health equity. Because we all know that for far too many, the prospects of a long, healthy life are very far away indeed. Limited by how much money you've got, where you live, and actually a lot of discrimination. And I'd like to say it's not just health leaders and champions. It's not just the usual suspects that are saying this. If you read many speeches by Christine Lagarde, the chief at the IMF, she's highlighted to business leaders and governments that widening inequalities of all kinds will lead to instability in society. So we've got some urgency here. And I thought I'd just give a couple of thoughts from me on how we might approach this and where the opportunities might be in this current context. So first of all, to national level, perhaps we could take our lead from Welsh public policy and argue for a Future Generations Act for the UK. At present, as many of you will know, this is Wales only. But the potential of this act is to encourage long-term thinking, the ability to plan and invest beyond the short-term thinking of our politicians. This act can help ensure that our policies, whether they're transport, education, housing, and leisure, take into account the health of our children and our children's children. It's a real opportunity to make a lasting difference with that act, the Future Generations Act, as a lever for change. The second opportunity, I think, to enact health in all policies is to take a leaf out of the Scottish playbook and view health from a social justice perspective. We've tended in public health to focus on interventions in economic terms. That's what we think the Treasury wants, the return on investment. But actually it hasn't worked very well for us. Look at those shrinking budgets in recent years. We could make better use of human rights law and language as they're now doing in Scotland. They've created a national action plan which enables public bodies to integrate human rights into all their work. It's a binding force for issues such as housing, employment, education, and health. The right to health is related to all the other rights we have, and if you upset one area, inadequate housing, then your health's in jeopardy. This is much understood there, and an emphasis on this wider determinants of health supports this rights-based approach. It also creates the kind of process where we have people at the centre, where services are available, accessible, acceptable, and equal. An approach which the Scots have recently argued should be championed from the grassroots to the boardroom and has the potential to really gain some traction with the public. We're going to hear today about the opportunities for health in all policies at regional and local levels, with many more elected members and leaders in place-based partnerships, systematically and explicitly incorporating health considerations into all of their decision-making. Many people have argued to me recently that all the innovation in this space is happening at local level. And that's because communities, local authorities are effectively collaborating in really practical partnerships. And we're going to hear much more about what works in that space today. So I am delighted to introduce our first speaker, who of course needs really no introduction from me. Professor Sir Michael Marmot, Director of the Institute of Health Equity, past President of the World Medical Association, and an internationally renowned researcher, author, and speaker. I'm sure you've all read The Health Gap, but what you don't know, I wanted to tell you something you don't know. I was at the American Public... Come on, Michael. I was at the American Public Health Association meeting a couple of years ago, and I saw the first standing ovation for anybody on this agenda anywhere. 10,000 people stood up after Michael spoke. It was an incredible experience.